Hello, Jackson College nursing students. This is Darlene LaPresto, and I'm in the skills lab. And I'm wanting to show you some of the different materials and equipment that we will be using with the urinary system. And so I have it laid out on a table here for you, and I'm just going to talk about a couple of these products that you'll see in the skills lab and in the hospital. First, we have a urinalysis testing strip. And when we talk about the urinalysis, you will become familiar with what's normal and what's normal as part of a urinalysis. And so these strips quickly tell us where the patient stands at any given time. Here's the bottle. And there's lots of different makes and models, but they usually look just like that. Back here we have a filter. This is for someone who may have a renal stone and we have to strain their urine to catch the renal calculi. So we catch it in several different things. We can catch it in a specie hat, which is what we have here. Notice with the specie hat, there are markings on the inside so you can measure the exact amount that the patient voided, and then we would take the specie hat and we would pour the urine through the strainer into the toilet, catching any of the possible renal calculi. This is a urinalysis cup, and it has markings on the side. You need at least 10 mLs to send to the lab. This is a male urinal, and again it's kind of hard to see, but it has markings on the side so you know exactly how much output the patient is having. You want to keep that empty and at the bedside within reach at all times. This is a 24-hour urine jug that we use. We keep it on ice in the bathroom while we are collecting 24-hour urine specimens. Again, it has the amount markings on the side, and if the patient voids more than 3 liters, then we would have to get another jug. All right, so moving down to catheters, and you have some slides in your PowerPoints that show you all the different types of catheters, and you'll be manipulating these and working with these in the skills lab. This is an indwelling catheter. It has a balloon at the tip, and then it has kind of a Y here, and this connects to the catheter bag, and this is where we put the air in for the balloon. This stays in for several days, and then as soon as possible we want to take that out so the patient doesn't get a urinary tract infection. These come in different shapes and sizes. They are, it's called French. So this one happens to be an 18 French with a 5 cc balloon. Okay. This next catheter is an example of a straight catheter. You'll notice it has a red tip on the end, and it's just a straight silicone catheter. There's no balloon or anything. This is for intermittent catheterization to remove urine and empty the bladder. Again, these come in different Frenches. This one's a 16 French, so it's smaller than the 18. Kind of hard to see here because it's clear, but this is not meant to be left in. We insert it into the bladder, we drain the bladder, and then we take it right back out. That's called a straight cath, and you'll have a skill on that. This is a female catheter kit, again for a straight cath that some hospitals will use. This, you notice, is an 8 French, and in the cath kit we have a catheter which is connected to the specimen vial. So to help make sure that the specimen is collected in the most sterile technique, this is all sterile inside. You have your gloves, you have your drape, and then you would just insert this catheter into the patient. The urine will fill up this vial, and then you disconnect here, label it, send it down to the lab. So that's a really nice kit, makes it easier to obtain and keep the specimen sterile. This is what we use for a leg. We call it to secure the tubing for the catheters that are indwelling, and we adhere that to the thigh or the abdomen, usually the thigh, and then the tubing goes through this clamp here, and it keeps it secure so it's not being pulled while the patient's moving around in bed. This is an example of a condom catheter, and it's just like it sounds. It rolls onto the penis just like a catheter condom does, and then the tubing is hooked here to the drainage system, and then it'll have be attached to the bag. And this is the type of bag. This is one type of Foley catheter bag. Now this one has what we call a urometer on it. It's a plastic device. You see these used mostly in ICU, CCU settings because we're being very particular on how much urine the patient is voiding out. So this is as little as 5 milliliters, 10 milliliters, 15. We want to be very precise with certain patients who are dehydrated or in fluid volume overload in a critical care setting. So this is called a urometer. Sometimes the bags will come without it, in which case the bag will look like this. Okay, and it'll be clear so you can assess all the characteristics of the urine, and then you have your measurements on the side, and we'll teach you how to empty those. Here's the clamp. See if I can do this with one hand. So you unclamp it from the bag, you get your measuring device that you're going to empty it into, and then you release the steel clamp, empty the bag. Be sure that you do the steel clamp again, clean the edge of the tip there before you put it back in place. Okay, of course that's hanging below the patient's waist at the bedside. We'll show you how to do that. Now on this end of the table I have more for bowel elimination. So we have a bedpan, which could be urinary or bowel, and this is a fracture bedpan. Notice how flat it is here, and so this sits at the front and your booty sits here, and that's to help with patients who can't tolerate being on a regular bedpan where the back is a little bit taller. Here is an example of a Fleets enema. They come pre-filled, all different kinds. This one happens to be saline, but we have oil retention, mineral, etc. We'll talk about those in class. This is a soap suds enema kit, so it comes usually in some sort of a box, and it comes with this clear bag. It's, I believe it's a 1500 ml bag, and the markings are on the side, and a bag of Cacetyl soap, and you mix it up in there, and then we hang this at the patient's bedside, and then it has tubing on it, and this is the tube end that goes into the patient's rectum, and so we lubricate it, and then we insert it 3 to 4 inches. It has a clamp on it as well, so that you can control how much fluid you're giving the patient so that they can retain the enema. The longer they retain the enema, the better the results are going to be afterwards of softening that stool so that they can expel it. And we may have that set up in class when you come to skills. The last device I want to show you is called a Flexi Seal, and this is a fecal management system. We used to call them rectal tubes. And what we have is a flexible tube here that's inserted into the patient's rectum, into the colon. And then it's attached to a collection bag, very similar to a colostomy bag. And then again, we measure. So this could be used with an ostomy as well. So one last visual of some of these products.